You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, it's called full mouth reconstruction. It's extreme smile makeovers. According to my first guest, he says nobody should be wearing a denture, a traditional denture, and also your teeth and gums are never too bad to have the smile you've always wanted. With us, we have Tennessee's go-to dentist when you have a lot of problems and you want to fix your smile. With us, we have Dweik. Dr. Dweik, welcome to the program.
Thank you for having me. It's a pleasure to be here.
Good. I know you brought a stack of photos.
Yes.
So we'll get to those as soon as we can.
Okay.
But for people that don't know your practice, I guess Memphis dentures and dental implants, is that right? Who's the typical patient you see?
So we see all types of patients, but if we're gonna break it down, it would be the first type of patient would be a person that's had dentures for a few years and they don't like the way they feel, they don't want to use the glue, they're tired of having glue get in the food, they're tired of the denture falling out, and they want to be able to eat the foods that they want. So they come in and we're able, using dental implants, to give them a fixed permanent smile.
Okay.
The second type of patient is the patient that has severe gum disease, bad broken teeth, missing teeth, a lot of infection, a lot of severe pain. And they're wanting to go from that into a fixed permanent smile where they can eat and chew whatever they want and smile beautifully. So our second type of patient is a patient that has severe gum disease, bad broken teeth, missing teeth, a lot of infection, bad breath, and they know that they're heading towards dentures, but they don't want to have dentures. So those type of patients, we're able to, using dental implants, give them a fixed permanent smile that does not come in or come out that same day, so they can eat and chew whatever they want and also smile beautifully.
Okay.
The third type of patient is a patient that's not quite ready to have all their teeth extracted. They have a lot of good, beautiful teeth that can be saved, and they're just missing a few teeth, and they want to be able to smile better and chew better. So we're able to replace those missing teeth and give them a full, beautiful smile using the teeth that they have. Our fourth type of patient that has a lot of tooth pain, bad teeth, and they're not quite ready for implants just yet, but they want to get out of pain and they want to have a beautiful smile. So we're able to make them a beautiful cosmetic denture in the meantime, and then whenever they feel like they're ready, we can transition them into a snap-in denture that's able to snap in and snap out, so they're able to eat and chew a lot more comfortably. Or when they feel like they're ready, we can actually go into a fixed permanent smile.
Okay. Now, we talked on the phone, but I didn't quite get it. We were talking in the green room. You say, we don't do fillings and, fix cavities. You're not like a general dental office, even though you're a general dentist, but this is all you do, is implants and dentures.
Yeah. So
is that right?
That's it. So all we do at Memphis Dentures and Implants is we just focus on specifically surgery. All we do is implants, extractions, and cosmetic dentures. So we're able to, we have patients that come in, we're able to let them leave that same day with a beautiful permanent smile.
Now, I've interviewed your partner on the show, Dr. Austin Davis.
Yes.
And he says he feels like that you guys created like a dream team where you do everything under one roof.
Yes.
And tell me if this is correct, that how, like implants or full mouth reconstruction is typically done, is you go to one place for the surgery, and if you have gum problems, you may go somewhere else, like a specialist, periodontist, to get that done. But you kind of do it right there. You do the surgery and make the teeth.
Yep.
Right there.
Yes.
Okay.
So the benefit of something like that is, besides the drastic amount of time that we're able to cut, instead of going from one dentist to the other or sending off to another lab, which takes 3 weeks to a month, we're able to do everything in-house. And not only that, instead of communicating over the phone with the lab, we're able to have the lab and the dental technician sit with us.
Right there.
Sit with us, right there. And we're able to design and plan the smile before and after the entire process. So not only are we able to cut the amount of time, but we're also able to make sure it's a much better result that's custom for that patient.
Okay. Are there a lot of people, like where you are, with really bad teeth, or that hate their smile?
You'd be surprised by the amount of people that do not like their teeth. In the Memphis area alone, we could literally take the FedEx Forum, the Pyramid, fill it multiple times over with the amount of people that don't like their teeth, that hate their smile, they don't want to show their teeth. People that are just, very unconfident about their teeth.
Okay.
You got to remember, these are people that, they've had bad broken teeth for a very long time, and they've developed a lot of insecurities, just general anxiety about their teeth. So they become very adept and very skilled at hiding their smile.
Hiding their smile. You could spot it as a dentist, like you could spot who's hiding their teeth.
Absolutely. You see very, young, beautiful people or older people with, they're very lively, but you notice in all their photos, they're not showing their teeth. They're not able to show their full smile. They're not able to express themselves. So,
Okay,
which is a real shame, because it's a very things have changed so drastically, and it's such a simple fix to be able to give them that beautiful smile very quickly.
So if everything works out, I mean, somebody that literally has watching this without teeth, maybe they're wearing false teeth, or somebody that has a full mouth of teeth that have to be removed, and let's say they're watching this on a Monday, by the end of the week they could have their new teeth, upper or lower, that don't come out?
If they saw this in the morning and they were able to come in that same Monday morning, they could come in, we can diagnose everything, and they can walk out that same afternoon with a beautiful fixed smile.
Okay, sounds like an exaggeration, but you're...
No, I'm very serious.
It's because you have the lab right there.
Yeah.
Really?
We've actually done it before.
But do you normally do it over like a couple of appointments, 2-3 appointments? Or is it just getting that short?
It really depends on the patient and their schedule, but if they're in a time crunch, we're definitely able to do it that same day or over multiple appointments.
Now, you consider yourselves like the premier center in Memphis for implant dentistry.
Yes.
Is that right?
Yes.
And dentures. Most guys that are in the dental implants that I've interviewed, they don't do dentures at all. I said, well, what do you do with the people that can't afford to do the other thing? So what are your thoughts on that?
Everybody deserves a beautiful smile. Just because they're not able to jump into implants just yet, that should not prevent them from having a beautiful smile. And the way we do our dentures and have our own in-house lab, we're able to, if we're not able to give them implants, we're at least able to give them a much better fitting denture, a more comfortable smile, a smile that they love more. They at least deserve that.
Nice, very nice. Now you brought some photos. What are we looking at?
Yes, let me show you. So here's this patient. He's a relatively young guy, mid-40s. He came in, he told me, hey doc, I've had bad teeth for well over 20 years. I've been going from dentist to dentist, and they just keep fixing a tooth here, a filling there, a crown here. And in the back of my mind, I know, he's telling me this, that he knows that this is not the final solution for him. It's covering up his problems, and it's not solving it for him.
Did he feel like he's going to head toward dentures?
Yes.
Okay.
Not dentures, but he knew that he needed full mouth reconstruction. He knew that. It couldn't be piecemeal dentistry. So he came in, he told me that he had enough. He's tired of not being able to smile confidently. Verbatim, that's what he told me. He's like, I'm tired of not being able to smile confidently.
Do you get excited when you hear that? Like, even though they're telling you a hard luck story, but you're going, this guy has no idea how good it's going to be.
This is all we do, and we specialize in this.
Okay.
I love when patients come in like this. He came in, he was tired of his bad broken teeth, and he was ready to smile confidently. So for him, we were able to extract everything that same day, place in implants for him for a denture, not a regular denture, but one that's able to snap in and snap out.
Okay.
One where we're able to cut out the palate part, the roof of his mouth, so he can eat and taste his food comfortably, be able to snap it in and out without having to use any adhesive or glue. So
could he eat like salads, things like that?
Yes, salads,
meat,
barbecue. I mean, we're Memphis, so barbecue, and any food that he wants to eat very comfortably without having to use adhesive. Because a lot of our denture patients, when they have adhesive, it gets stuck between the food. It's just not a very comfortable experience for most people. But for him, we're able to take him from this bad broken smile with a lot of pain into something like this.
All right. Oh wow. Yeah. Very nice.
Randy, put them side by side.
Okay. So it's a big difference.
Huge difference, right? He looks a lot younger in this photo.
Yeah.
A lot younger. He is able to smile very confidently. He loves to smile. Actually, I don't know if you're able to notice, but he told me that when he came in that next day for that smile, he actually trimmed up his beard.
Okay.
He fixed it up to show more of his smile, because beforehand he kept it as grizzly as possible to cover up his teeth. But right here, he's already trimmed it down a little bit just to show off that smile.
Do you think he's going to even cut it shorter?
Oh, he told me that he plans on shaving the entire thing.
Oh, is that right?
Oh yeah. Oh yeah. And the funny thing about him, I was talking to him. He was telling me, he's like, Doc, right now he's trained himself not to smile for so long, for over 20 years, that he tells me he catches himself in the mirror and he has to physically train himself how to smile.
Wow.
Because he's so excited to show off the smile.
Now, these snap in, snap out, that's an option.
Yeah.
You could also give them teeth that don't come out. Is that correct? And this is a more affordable option.
Yes.
Is that correct? Isn't it true, though, if you've been wearing a denture like 20 years, you don't have enough bone to get the dental implants?
No, not at all. No.
Okay.
The vast majority of patients, that's actually a pretty common misconception that we have of patients. They come in here thinking that they've had dentures for so long, there's no way they can get dentures. There's a simple CAT scan, which we offer, we can, on the spot tell you whether you have enough bone or not. And even if at that moment you do not have enough bone, it's just simply a process of regrowing that bone. Our end goal for this patient is to move him from the snap-in, snap-out dentures into a fixed full arch.
Okay. Is this the future of dentistry? Like, let's say 20 years or 50 years, that dentures as we know them today just won't exist. They'll all be attached to something.
It's
like implants.
It's no longer the future. We're actually doing it right now. I mean, this is going to be the main procedure for most people.
And earlier you said, you specialize in this, and I know it's not a recognized specialty, but this is your focus.
So we're not, there's no specialty for implants just yet, but all our office focuses on right now is just implants.
And you guys travel all over the place to learn this stuff.
Yes. So they don't teach us.
Really?
Yes. Well, they don't teach us in dental school. So
like Brazil, I heard. I mean, you guys are learning this stuff
all over. As I said, they don't teach us in dental school. So we wanted to have our practice just focus on implants. So we spend hundreds upon hundreds of hours every year traveling all across the country, learning from the best implantologists in the country, just to focus on this stuff.
Now, because you do it all right there, you said also that you're a little bit less expensive than most.
Yes. So since we're able to do it all in the same office, we're substantially less than most offices when it comes to fixed full arch.
Okay. And most of it is because you have your own lab there, things like that. Plus you do both parts, the surgery and do the teeth. Is that what both you and Dr. Davis do?
Yes.
You pretty much have similar training? Mm-hmm. Okay, good.
Yeah.
Another photo.
Yeah. Let me show you this. The next patient. This man right here, he came in, he was tired of his smile, he had a regular denture on the top, and he had some bad, broken, decayed teeth on the bottom. He just didn't like the way they looked. And he was ready to move into a more permanent, fixed smile. Okay. So, you can tell right here, he has what we call a collapsed bite, where he's not open as much as we want. His face is sunk in. He thought his only option was another cosmetic denture on the top, and another denture on the bottom. He did not want that. He was looking for a more fixed smile. With as little as 4 to 6 implants, we were able to give him a full fixed arch of teeth.
Okay.
And you can tell.
And they don't come out.
No, they do not come in or come out. And not only that, so one of the biggest differences in a fixed full arch of teeth is the ability to eat and chew food. Okay. So when you have something fixed with implants, how hard you bite, how hard, the ability for you to chew is drastically increased compared to a regular denture.
Okay.
So, if you want to eat that juicy burger, you want to eat that barbecue, a regular denture is not going to cut it. When my patients come in, I always tell them, I need you to find a reservation for your favorite restaurant, because whenever
like a steakhouse or something.
A steakhouse or a barbecue. We're Memphis, a rendezvous, right?
Okay.
So make a reservation, because whenever you have these teeth placed, I want you to go out and, have the meal of your,
Do you ever get eating stories where they say, Doc, are you sure I could eat this?
So the previous patient, he told me, it was a very funny story. He's telling me that he told his wife she needs to set aside quite a bit of money because he plans on going on every possible restaurant he can go to.
Okay, so the most expensive part of this procedure is all the foods and the restaurants you go out to.
Yes, absolutely.
So you have the after over there. Let's take a look.
So here's this patient. Do you notice a drastic difference in his smile?
Yes, I do.
So
he almost looks proud of his smile.
He's super proud about his smile. It's a 9-day difference. And do you notice how here we're able to open up his bite, so stretch his facial tissue, so he's able.
He looks younger, a little bit younger.
He looks younger. It gives him a more youthful, younger appearance, and we're showing less bottom teeth and more upper teeth. And you see how the upper teeth they follow the the lip line of the bottom.
Yeah.
That wasn't haphazard. That was we designed it. But it was by design. Okay. We planned it by design. Us and the lab tech were able to sit down and plan all this beforehand.
Well, I would have a different impression, as we've talked about in the green room, if I met him that way on the before, and if I met him the second way.
Right here is one of my patients to say he's smiling out loud. He wants to show you a smile, right? Okay. He doesn't want to cover it up. He's confident, he's excited, the way he's leaned back and relaxed. He wants to show you that smile. Compared to this one,
different story.
It's a different.
So is he walking around Memphis right now, probably somewhere smiling and talking? And
yes, absolutely. When we first came in, to get words out of him was quite a struggle. He was a very shy, nervous person. And then after this, sometimes it's hard to get him to stop talking. He just keeps talking. So, next photo.
All right.
This young lady came in. As you can tell, she obviously cared quite a bit about her teeth. She invested a lot in getting crowns and fillings.
That's unusual, isn't it?
No, not at all, Randy.
Okay.
This is actually extremely common. Most of her patients are like this. You think it's uncommon because they're very good at hiding their teeth. They don't want to show their teeth.
Okay, good point.
The vast majority, a lot of patients, have, as we said, bad and broken teeth that, they're very skilled at hiding it. But they're
So what did you do for her?
So for her, as you can tell, she had a lot of work done, but after many years, a lot of her work is starting to fail. She has a lot of infections, bad broken teeth, decay underneath the crowns, and there wasn't much that we can do to save these teeth.
Okay.
And she absolutely refused to have a denture. She did not want something that came in and come out. She wanted a permanent smile. So for her, what we're able to do, we were able to extract everything, get rid of the gum disease, and we were able to, using implants, give her a permanent smile that does not come in or come out.
Okay.
Yeah. And something you can notice looking at before and after, do you notice how before she had a very gummy smile where she shows a lot of gums, and we were able to remove that and give her a more youthful appearance.
So you kind of contour the gums?
Yes.
Okay.
Yes, absolutely. We contour the gums to give her a more youthful appearance and show less of the gum. We're able to give her a permanent smile that doesn't come in or come out. And her reaction, obviously we gave her some sedation to have her relax during the procedure. And when she kind of came to, she saw the smile. She could not stop grinning. She was just holding the mirror, just kept looking at her smile all one day, Randy.
Did they ever get choked up? Some of them?
So that's probably my favorite part. So this is a very emotional and raw experience for everybody involved. You got to remember, Randy, there's people that this has been a massive source of anxiety and insecurity for them. So when they're able to look in a mirror and they're able to see that it's no longer a source of anxiety, but rather a source of pride and confidence, they're overcome with emotions. We have patients that they start crying, and even my assistants, we all they start tearing up, and it's an awesome experience. It's life changing.
How old can you be to get this done?
So,
like the oldest patient.
I've placed implants on somebody over 90 years old.
Why would you want to do that?
So I asked him that question because it's not very it's not often that you get 90-plus-year-old patients. But I asked him, I was like, why do you want to get implants? He told me, he's like, I work too hard in my life. I want to be able to enjoy the rest of my life being able to eat the foods that I want comfortably. I don't want to have to use glue or adhesives and not be able to chew and not be able to eat the foods that I want.
So the 90-year-olds, they're not statistically, they're not, the implants aren't more likely to fall out if you're 90?
No.
So really?
As long as you have good, healthy bone.
So a 75-year-old that goes in your chair and says, I'm a bit old, that's like young to get this done.
It surprises me every time.
Really?
I have patients that are like, I'm 65, I'm too old, or I'm 55, how many more years do I have left? I'm like, that's not the right way to look at it. Hopefully you have a very long, bright future ahead of you or life ahead of you, and be able to enjoy the foods that you want. Why not?
Well, you're a dentist, so you probably think, the smile's the most important thing.
It's not because I'm a dentist. Realistically, when you see somebody smile, what's the first thing? One of the first few things you're going to notice about them? It's the smile, right? And even
smile, eyes, okay.
Even statistically, survey after survey has shown smile is always one of the top 3 things listed. Correct?
That you like about somebody or remember about somebody.
Notice, actually, to simplify it, let me give you an example. Say, for example, we had 2 identical people, Randy.
Twins.
Twins, right? Twins. Everything is the same personality, same life. The only difference is one of them has bad, broken teeth that they're not confident about, right? And then you have another one that has a beautiful smile. As we said, they're smiling out loud. They're very confident about it. When you're interacting with them, the person that doesn't have the smile that they want, and they're not confident about it, when they're talking to you, they want to avoid showing you their teeth, right? So they're looking away, they're looking down, or they don't want to talk to you as much. They want to cover up that smile, right? You're going to have an impression of them, correct?
Yes.
They're not able to express their personality and their confidence to you, which is a shame. While the other person, the same person, the other twin, they have that beautiful smile. They can't wait to keep talking to you. They want to show you their teeth. They're not afraid to show you their teeth. So they're able to express their entire personality.
Well, you know, I don't know if you would hire just the person with a prettier smile, but if one is smiling and one isn't, obviously you're going to hire the one that looks happy and positive. And
so imagine if that was a job interview.
That's fair.
In the job interview, it's going to make a difference. That smile will make a big difference, right? But even my wife would say, even more important than that, say you're going on a date and you're going to meet your possibly future husband, next husband or wife. That's going to make a big difference. That's correct. True. You can't express yourself. So it is extremely important. I think it's a very important thing. And it's not fair because people with bad teeth, they're judged. I mean, unfortunately, society and the media, they always portray people with bad teeth as, unhygienic or poor.
Like in the movies.
In the movies, yeah. And it's not. I mean, it's not. I think it's incorrect and it's not fair. But that's unfortunately how it's portrayed a lot of times. And another thing that I like to say is that for people that have these anxieties about their teeth, it really bothers them, so it's a huge deal to them.
Okay.
You see, it's so.
So when it changes, it's like an easy thing. I mean, it's technically demanding for you to fix.
Yes.
But the bottom line is,
it's life changing.
It's kind of an easy fix. I mean, of all the things that you hate about yourselves, teeth is an easy one to fix for you.
Yes.
Yeah.
Yeah. I mean, this is all we do. So for us, as you said, for us, we see, this is a very fixable issue for us. You can give you a beautiful smile, and for people, when they're able to do it, it's a life-changing experience for them.
Now, we titled this program, this full mouth reconstruction, which means, in some cases, saving teeth.
Yeah.
You say that you're going to save teeth, because losing teeth is expensive, as you say. So if you could save teeth, you'll do that too.
Absolutely.
Okay.
So with full mouth reconstruction, the goal is not just to extract everything, right? Every patient's different. It's what full mouth reconstruction is. It's not piecemeal dentistry. We're not looking at a single tooth, filling here, crown there. We're looking at the mouth as a whole, right? And we're working from the ground up. So whether if there's a lot of good teeth, we're going to keep them, we're going to save them.
But what if you have bad gums, like gum disease?
That's not an issue at all.
Will the implants stay? You can still get implants with gum disease.
Randy, that's the vast majority of our patients have.
So the implants can still go in the bad gums?
Absolutely. Absolutely. And as I said, with full mouth reconstruction, we'll focus, if they have severe gum disease, then as we said, we're treating it from the ground up.
So we'll clean up the gum disease?
We'll clean all that up. We'll take care of it. Whether it's extracting all the teeth, we'll extract all the teeth. There's teeth that we can save, we'll save the good teeth. But we will make sure that the foundation is healthy for us to place the implants.
Now, your partner, Dr. Davis, he said that people finance this, every week.
Yes.
So it's very common. People are financing this. Because dental insurance, we should mention, covers a very small amount. Medicare, Medicaid doesn't cover it at all.
Unfortunately, which is not fair. Hopefully that changes.
But you have to have decent credit. I mean, what you have lenders that lend for people? So
we work with multiple third-party financing companies, and so that same day that you're coming in for a diagnosis, you're able to apply. And they're, whether bad credit, good credit, we work with different companies to make sure that we're able to treat all patients. For people that have really bad teeth, let's say, and I said this earlier, but I was talking about denture patients. But if somebody has really bad teeth that needs extractions and things like that, on a Monday, they go in, is it possible by Friday they can get their new teeth that don't come out? Sooner, Randy, even sooner. We've done how sooner? So, as I said, if they come in... Don't hold back here. If they come in on a Monday morning, they're coming at 8 a.m., and they know what they want, we're able to get started that Monday to start working on their teeth. As early as Tuesday, they can get their teeth. Is that right? Even if you had extractions as well? Absolutely. Absolutely. Okay. And that's the beauty of our office. We're able to do the extractions, implants, and you're planning things on the computer, you say? What does that mean? Like when you're saying you're pre-planning surgeries on a computer, what does that mean? Yes. So we're taking the guesswork out of this. We offer complimentary CAT scans. So we're able, what a CAT scan is basically it's a 3D image of your bone structure and your jaw structure, right? So we're able to come in there, we're able on the computer to plan and design the entire procedure before we even do it. We're able to offer CAT scans for these patients, which is basically a 3D image of their bone and jaw structure. So we are able to plan and design the procedure entirely before we even do
Start.
it
Okay.
before we even start. We're taking the guesswork out of it. We're able to, we're not going in there blind.
Is that what this digital dentistry? Is that what you call it, or what's?
Yes, it's a huge part of it. The CAT scan is a huge part of it, planning the surgery, and then not only the surgery part when it comes to making the teeth. As we said, we're doing a lot of this, or most of this, on the computer, so we're able to have the lab tech come in with us, and we're able to design that smile beforehand and afterhand on the computer using your scan.
Now, I know you brought a couple more photos,
Yes.
so we have time for 2 more, so I'm going to rush you a little bit.
All right, let's show you this patient right here. So this is my partner's patient, but it illustrates a great point. She came in with missing and broken teeth. She did not want to have something removable. She wanted a permanent smile.
Okay.
And she wants something that she can comfortably eat. She's young. She wants to be able to eat her foods comfortably. So for her, we were able to extract everything, place in multiple implants to give her a full arch of teeth that same day.
That don't come out.
That don't come out.
It's a pretty smile.
Beautiful
There's no doubt
smile.
about it.
She looks more confident. She looks younger. She's happier. See how as I said, we're showing just the right amount of teeth to give that youthful look. And then here's our other patient.
Okay.
This is also another patient that my partner did. But I love this case because it really it shows how dramatic of a difference we can make. She came in with bad broken teeth, failed crowns, failed endo, failed root canals, and she did not like her smile. And she wanted, as I said, another permanent fixed smile. We were able to extract all her teeth in the same day, give her implants that same day, and have her walk out with a fixed set of teeth. So at the beginning, we tell them to stay on a soft diet, but before long, they're going to their favorite restaurant, eating whatever they want. So.
Is it the big is it steaks, or is it more like corn on the cob or salads? Apples. What do you hear? Like, what are they really?
We're
what are
Memphis,
they after?
so it's barbecue for us. But
okay.
Barbecues are a big thing.
Right off the bone? They could chew.
Right off the bone.
They could even chew bones with this, possibly. You're not supposed to.
I don't want them to, but yeah, they can if they want to.
We're out of time. Final message to somebody, they've heard your message, but they're still skeptical or afraid to go to the dentist. What do you say to them?
If you have bad broken teeth, you don't like your smile, you're in severe pain, you owe it to yourself to come in, let us diagnose, see what issues you have, give you solutions for them, and you can at least know what you can
think
do.
about it.
You can think about it. Yeah, you have nothing to lose. It's a free consultation, and please take them. Take the treatment plan. Go shop around.
Dr. Dweik, I want to thank you for coming to the show. Good stuff.
Thank you for having me. Appreciate it.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.